Welcome to Fertile Minds. I'm Dr. Hector Georgiou, a fertility specialist at Melbourne IVF. Hormones play a crucial role in regulating various bodily functions, and when imbalances occur, it can affect not only overall health, but also fertility. Hormone replacement therapy, or HRT, which involves the administration of hormones to replace or supplement the body's naturally occurring hormones, is used to address a variety of conditions. A common concern I hear from patients is whether HRT can impact your fertility. Today, I'm going to explore the different types of HRT, the impact it can have on your fertility, and what to consider if you're undergoing treatment. Estrogen is a key hormone responsible for regulating the menstrual cycle and supporting fertility. During menopause, estrogen levels decline, leading to various symptoms such as hot flushes, mood swings, vaginal dryness, and sleep disturbances. Estrogen therapy is commonly used to help alleviate these symptoms for women going through the menopause or perimenopause. Progesterone is often prescribed in combination with estrogen to women with a uterus, as estrogen alone may increase the risk of uterine cancer. Progesterone plays a crucial role in preparing the uterus for pregnancy by supporting the implantation of an embryo. Testosterone replacement therapy, a common form of HRT for men, can affect sperm production. Some men may experience a decline in sperm count, which could impact fertility. Hormone replacement therapy can have varying effects on fertility, depending on factors like age, overall health, and the specific hormones used. For women taking HRT before menopause, fertility may be maintained, and in some cases, even improved. HRT can help regulate your menstrual cycle and promote ovulation, enhancing the chances of conception. For postmenopausal women, the impact of HRT on fertility is more complex. While estrogen therapy alone may not significantly affect fertility, combining estrogen and progesterone can have a different outcome and potentially reduce your fertility. The age at which you start HRT and duration of treatment can influence its impact on your fertility. Starting HRT closer to menopause may have different implications than starting it at a younger age. Women considering HRT for fertility should be aware of potential health risks associated with long-term hormone use, such as an increased risk of blood clots, breast cancer, and cardiovascular issues. These risks may also vary depending on how HRT is taken, for example, as tablets or patches. Before embarking on hormone replacement therapy for fertility reasons, we recommend having a consultation with a fertility specialist to help determine if this treatment is right for you. Thanks for watching. For all things fertility, please feel free to subscribe.